Hello everyone, I'm Dr. Crystal Song, Rehabilitation Medicine Specialist in Melbourne, Australia, and also part of the ISPRM Communications Committee. Today we have our honoured guest, Professor Fary Khan, whom we're delighted to have her time in giving us a short interview. Professor Fary Khan is the Director of Rehabilitation Services at the Royal Melbourne Hospital in Australia, Clinical Director of the Australian Rehabilitation Research Centre, and Clinical Professor in the Department of Medicine at Melbourne University, and she holds many positions nationally and internationally with various societies. She has extensive experience in neurological, cancer, and trauma rehabilitation and setting up evidence-based rehabilitation programs. She's published over 500 scientific papers and received numerous awards for her incredible work. She is also an international member of the US National Academy of Medicine, President-elect of ISPRM and Asia-Oceania Society of Neurorehabilitation. Professor Fary Khan is one of our keynote speakers at our upcoming ISPRM conference in Marrakech 2025, and she will be delivering her keynote lecture on rehabilitation and women's health, global challenges and opportunities. Welcome, Professor
Thank you
Fary
very
Khan.
much.
How are you going today?
Thank you very much, Crystal. It's a real pleasure to be able to chat with you and all our members of the ISPRM. So I'm looking forward to seeing you all.
As we all know, Marrakech is a beautiful large city in Morocco. Can we ask what you're looking forward to in particular in Marrakech?
Yes, I've been to Morocco a number of times, and I think it's a beautiful, very exciting place to be. And I think for me, I hope that Marrakech has recovered from the earthquakes the last year that we had. So I hope for the sake of the people, they're brilliant, resilient, lovely people. So I hope that we can have a good time and learn from them and look at their culture and beautiful cuisine and catch up with all our friends.
Sounds great. Now, Professor Fary Khan, can you give us a brief overview of your keynote topic that you'll be delivering in Marrakech?
Yes, the theme of the Congress is all about challenges for rehabilitation medicine in light of the WHO 2030 rehabilitation plan. So it's really very appropriate topic, I think. For me, I've selected the topic of talking about women's health and the challenges faced in rehabilitation from the rehabilitation perspective. And I noted that in the last many ISPRM congresses, we've not had a plenary on women's health and the challenges. So, for instance, we know that women face a lot of health inequities, such as access to health services, health literacy, stigma, and also gender inequality. And we know that there are a number of factors that affect health outcomes in women, such as biomedical factors, psychosocial, environmental, attitudinal, and of course, economic. And it's probably not been addressed in a Congress setting prior with any of the plenaries. So my focus is to actually present a roadmap of different stages or a life approach in different stages for women who have different healthcare needs and risks and the sorts of interventions they need to highlight the gaps, particularly for rehab medicine, and to then address it by strategies to implement an approach that will provide better health outcomes, improve their function, have them contributing members of the community, improve participation, that is, and go from there. And I think one of the most important elements of this is that I want to share a strategy that is used in Australia within our health system in Victoria, which provides like a blueprint about how do we highlight those deficits at every stage in the life of a woman or a girl, and what sort of interventions can we put at each stage, and what can we do together as the ISPRM to address some of those inequities.
Professor Fary Khan, what else can ISPRM do to address gender medicine?
Yes, a very interesting question, Crystal. So I think, firstly, just so you know, and all our members know, that the PC, the Presidential Cabinet, is looking at reviewing all of the task forces and the special interest groups. And of course, that information will be disseminated in due course. But to me, what is most interesting is that women's health is not by itself. When we have the SIG or the task force or a committee for disaster management, for example, which is the emergency management, the ERC, or we're looking at the NeuroSIG, or we're looking at any of the other SIGs or task forces, there has to be an element incorporated within the activities of those SIGs and task forces that address the women's health issues relevant to rehabilitation medicine. And there is also an International Society of Gender Medicine. So I think it would be great that we communicate, collaborate, and work with the Gender International Committee, the society that is, and have someone from our ISPRM represent us there so we can actually find common ground and work together, particularly with implementation of rehab input, specific interventions in a particular format that also addresses our agenda in terms of promoting health for women, particularly rehabilitative health, and also a generic global agenda of promoting and advocating for women's health. And I think in particularly the education committee, for instance, in my mind, the education committee, the communications committee, the advocacy that we can all do together by highlighting the plight of these women, the challenges, the health inequities faced by this population is very important. And we can then enhance the awareness and contribute to the advocacy of these issues, and then form a strategy. And my presentation in particular will talk about strategies about how we can address these to improve the function, the psychosocial, the mental and the environmental impact, and improve health outcomes in this population. And last but not the least, we have the WRA, the World Rehabilitation Alliance. We have fabulous ISPRM members who contribute to the WRA, and I think supporting them and doing little bits of work that we can then showcase as examples to encourage, I suppose, our members, particularly our young ISPRM committees and others, to participate and be part of a strategy that will take rehabilitation for women forwards in light of the 2030 WHO plan.
Thank you, Professor Fary Khan. That's very valuable information. Thank you for giving us your time for this interview. We look forward to your lecture and we're very excited to join you in Marrakech.
Thank you very much. I too look forward to seeing all of you and learn from all our colleagues. It'll be a wonderful opportunity to network. Thank you so much.